Good, good afternoon, everybody. I'm Danny Jackson with FEMA Region 7. I'm also the Deputy Incident Branch Director for the COVID disaster here in Iowa. And we're going to get started talking about some of these updates that have taken place with the opening and operating. So give me just a second to get my screen shared there. And there we go. So what we're going to talk about here, some basic COVID-19 eligibility, and then the safe opening and operations policy as it relates to the new updates that the president has given as of the beginning of this month. So then we'll also start talking about the medical policy a little bit. That came out back earlier. We talked about that in our last time together. And then the equitable pandemic response and recovery requirements that the president has put out to go along with this. So without further ado, we'll get into it. So for COVID-19, the general eligibility is like it is for most disasters that FEMA works with, that you've had experience possibly with Category B work. The work must be the legal responsibility of the applicant. The measures must be done to protect life, public health, safety, and generally the responsibilities of the SLTT. I'm sorry, my slides are a little behind there. And for COVID-19 declarations only, FEMA is waiving the primary use and primary ownership responsibilities and requirements for the private nonprofit organizations. For all COVID-19 declarations, FEMA has extended the deadline for emergency work indefinitely. Generally, this is a 6-month requirement, but as of right now, it's indefinitely extended, and FEMA will give a 30-day notice prior to establishment of a deadline. Consideration of cost. To be eligible, the claim cost must be necessary, they must be reasonable, and they must be pursuant to federal regulations and federal cost principles. Basically, a cost is considered reasonable if in its nature and amount, it doesn't exceed what would be incurred by a prudent person under circumstances prevailing at the time. So we want to make sure that there's documentation to support that you follow your best practices and procedures and that you're conforming with the FEMA eligibility and federal requirements. So applicants should determine which source is best applicable for them to meet their needs. There's a lot of sources out there through this COVID, as many of you have seen. And you've got to look at those sources and figure out which one is the best for you. If the applicant applies for PA funding and then determines that it would instead seek funding from another federal agency, the applicant should notify FEMA as soon as possible. However, FEMA shouldn't be considered a last resort. If you just decide that you want to go with FEMA as opposed to using CARES Act or using some other source of funding, then that's all right too. Just you can't accept both types. FEMA has determined that it will not provide reimbursement through PA for certain programs of work that may be eligible under another agency's authorities. An example of this would be contact tracing. COVID-19 contact tracing may be an emergency protective measure otherwise eligible for PA funding. However, in coordination with other federal agencies, FEMA has determined that PA is not the appropriate source for funding COVID-19 contact tracing, and there are more appropriate sources for these fundings. Additional considerations: FEMA is prohibited from providing financial assistance where such assistance would duplicate funding from another program, insurance, or any other source with the same purpose, including assistance from other federal departments or agencies, funding for clinic care funded through another source. At no time will FEMA request any personally identifiable information related to medical care of individual COVID-19 patients. FEMA will reconcile final funding on a funding source provided by another agency and covered by insurance or any other source for the same purpose. The federal cost share under FEMA is 100%, and this has been extended out till December 31st of this year. So instead of the normal 75% cost share that we generally do, the president has extended 100% cost share out to the end of this year. Now, as we get into the safe opening and operating, it's broken basically into three different types of activities. There's medical care, there's mass care, and then there's opening and operating. Specifically, we're going to talk about open and operating first. So the eligibility here, and you can see from the chart here, but we'll get into a little more detail here on some of these, has opened up quite considerably. If you remember earlier on in the disaster, we've had 3 different incident period basically of eligibility, where we had period prior to 9/15, we had a period from 9/15 to January 21st. Those have all been eliminated. And the president has basically said that FEMA will fund all eligible activity for all eligible applicants that are included in this policy all the way back to the beginning of the disaster. So on January 21st, the president issued a memorandum to extend federal support to governors in the use of National Guard to respond to COVID-19 to increase reimbursement and other assistance provided by states. Now, these are links here, so you can click on those and read the actual document when you get a copy of this here. FEMA issued the policy on April 15th, implementing an increase in the eligibility of funding under the Public Assistance Program for safe opening and operating as authorized by the presidential memo. And then on August 17th of 2021, the president issued the Memorandum of Maximizing Assistance to Respond to COVID-19, which directed FEMA to provide 100% cost share for Category B work for opening and operating listed under Section 3A of the Presidential Memorandum from January 21st. What that all means is that basically from work performed from January 20th, 2020 through December 31st, 2021 will be funded at 100% cost share, and work that was otherwise eligible under any of the previous policies will remain eligible. But there has been some increase in eligibility as a result of this policy update. So the following will remain eligible: medical care, purchase and distribution of food, non-congregate sheltering for medical purposes, operation of emergency operation centers, communication to disseminate public information regarding the health and safety measures, and to provide warnings about risks and hazards, and mass casualty management. The eligible costs that have been retroactively made eligible through this update to this policy include the purchase and distribution of face cloth coverings and PPE. Now, this is a good move here, because there was a lot of unclear language in the original PPE that some people were confused about whether face cloth masks were included in PPE and not. So they have included that in and distinguished it as an eligible item. Cleaning and disinfection. The cleaning and disinfection includes the purchase and provision of necessary supplies and equipment in excess of your regularly budgeted cost. Diagnostic testing for COVID-19, and that would be testing that also follows your testing protocols that are put in place by public health orders. Screening and temperature scanning, acquisition and installation of portable temporary physical barriers, and the purchase and storage of PPE and other supplies based on projected needs. FEMA will fund testing to detect COVID-19 infections in both medical setting and testings that needed to open and operate public facilities, including schools. Funding may be used to support both diagnostic and screening protocols. So this can include laboratory tests, test kits, including antigen self-test, contracting for testing supplies by a third party, staffing to administer the test, training of individuals on how to administer the test, the signage and communication materials, personal protective equipment and administrative supplies to conduct the testing, and technology to register and track the testing results. Now, the medical policy was updated back in February as a result, or March 16th, as a result of the president's speech at the end of February. And it supersedes the previous medical versions of the medical policy that were issued in May 9th of 2020. The medical care and associated costs to support the provision of medical care, including an eligible facility, equipment, supplies, staffing, and wraparound services, as well as assistance for clinical care and patients not covered under additional funding sources. So let's talk about what is actually covered under the medical care policy. The cost of vaccines is covered by the federal government and is not an eligible expense. You shouldn't, as an applicant, have an expense for the actual cost of the vaccine, and therefore that expense is not reimbursable by FEMA. It's covered under a different federal agency. Any claimed cost related to you purchasing applicants would not, or purchasing vaccines would not be eligible under PA. Additional costs to support the distribution, the administration of the vaccine would be eligible under PA, consistent with the established vaccine protocols, CDC and other applicable public health and PA program requirements. Community vaccination sites, these would be eligible costs. Costs associated with facility support, including leasing a space, the utilities, the maintenance, and the security involved with taking care of this vaccination site, the PPE and the supplies required for storing, handling, and distributing and transporting or administering the vaccination, equipment including coolers, freezers, temperature monitoring devices, and portable storage units for transportation, supplies that include medical supplies and sharps containers, transportation such as refrigerated trucks, and transport security. Additional staff and support staff, both medical and support staff, are eligible. Resources to support mobile COVID-19 vaccinations in remote areas, and transportation support for individuals with limited mobility. So there's a definition there for limited mobility. And on-site infection control measures and emergency medical care for COVID-19 vaccine administration sites, including masks, PPE for patients, disinfection of the facility, temperature scanning, acquisition and installation of temporary barriers, medical waste disposal related to vaccines, and on-site emergency medical care in the result of reactions or adverse. Let's see, communications to disseminate public information regarding vaccinations. So you're getting the message out that you're having a vaccination center open. Those are eligible costs related to that. Training and technical assistance specific to storage, handling, and distribution and administration of the COVID-19 vaccine. Vaccination costs incurred by a federally qualified health center or rural health clinic or critical access hospital that's not covered by HHS or other funding source are eligible costs. Information technology costs. There's three different ways that we look at these information costs. To the extent possible, we expect that the vaccine providers would utilize their existing IT systems. The CDC has developed a system called VAMS, or the Vaccine Administration Management System, and this is available for those that provide the vaccines to use as well. But if you realize that your existing system or the VAM system is not adequate for what your needs are, then you can go out and get the IT system that will be sufficient to take care of your needs, and that will be eligible under FEMA PA. PA may provide funding for costs that are not paid by another funding source, such as other federal programs, insurances, Medicare, Medicaid. Applicants are expected to follow their regular billing procedures, and SLTT governments administering COVID-19 vaccinations are not required to establish and implement new patient billing systems other than what they already had in place. Applicants will need to provide the following supporting documentation for their streamlined project application: the description of the activities, when, where, and by whom the activities were completed or will be completed, the list that including a list of vaccination sites, the number of vaccination sites by day and site, identification of supported population, a summary of the claim cost, including contract, labor, equipment, material, rental costs, and estimates for future cost, and additional documentation supporting completed activities. And here are some of the applicable PA guidance to go along with this. Now we're going to talk about equity. On January 21st, 2021, the president issued an executive order ensuring the equitable pandemic response to the recovery. COVID-19 has been disproportionately impacting communities of color and other underserved populations. SLTT must focus their actions to use the FEMA funding to the highest risk and hardest hit communities and underserved populations. So the idea and the point behind this is that our underserved communities need to be prioritized with our limited resources to make sure that we're giving an equitable pandemic response. Distribution of disaster relief must be accomplished in an equitable and impartial manner without discrimination. This has really always been a rule for FEMA, but this is just a way of the president is used to put this actually into a written policy and implement it as such. So as part of the reporting requirements for equity, we have, let me go on forward here, skip on through here. The reporting requirements for equity is that you must submit information about your vaccination sites within 30 days of obligation. If you have already submitted a project, if the project is new, then upon your initial submission, if the work is complete, you'll submit your information. If the work is not complete, it's ongoing, then within 30 days of obligation of this project. Now, what information are we looking for? We're looking for information on every site. That would be the location, the amount of people that come through, the amount of shots that are distributed, that the CDC Social Vulnerability Index or other similar score, and the strategy that you used for outreach and engagement, your registration process, vaccine site selection, the site accessibility, how is it accessible to those with mobility needs or different other factors that may hinder people from being able to get to that site. Evaluation and continuous improvement. So when you find things that could be done better, what are you doing to improve the situation? So basically that just goes into what we just talked about there. And quickly we'll look at grants portal and how you can upload this information. So your program delivery manager or your recipient point of contact can give you a template. FEMA will provide you with a spreadsheet template that you can fill out to provide the information that they're looking for their equity requirements. You can, when you go into grants portal, you'll log in and you'll go to your, sorry, give me just a second, put my glasses on here. You'll go into your organizational profile, and then you'll go to your applicant event profile. You'll drill down on the event there for 4483. And once you drill down in, you'll find the documents section. You'll go to upload in the documents section and drag the document from wherever you have it saved on your computer and upload that document. There have been some updates in Grants Manager and Grants Portal. I have included and Rick will include that. I'm sure there's some additional information on some updates that have been made to Grants Portal as it relates to the equity requirements. So once you get the document uploaded, you're going to click edit and you're going to specify what type of document it is. There'll be a drop-down option that will give you a list, and you're going to choose other and other, an equitable vaccine administration info. That's your description, and save. That will give you a green check mark. You'll know that it's good to go. So click green upload pending document, and you'll be able to see that in your documents section. We will be able to see that on our end, and that will be able to satisfy that equity requirement that's needed there. If there is information that is needed, additional information that is needed, or questions that weren't completely addressed, then this is done through a request for information. And there's information. It's a little different that if you dealt with requests for information before, they're a little different in this situation. So there is information in the packet that I've provided that will give you some more information. There's also links here where you can watch a video of the vaccine administration activities in Grants Portal, navigating through those. You can also utilize the Grants Portal help desk, either through email or through phone, or going through Grants Portal itself. If you forget, you can click on the help button, and that will bring up the information there that we've provided here with your email and the phone number there. All right. So, Rick, I believe that's it for us today.
All right, Danny, thank you so much for going through this. Appreciate all of your help in working through and navigating through this whole COVID process, and providing us all with guidance and lots of information as we've gone along through this through the last year and a half. And I just want to thank everyone else. This has been everyone that's joined, and this has been a tough year and a half for all of us, and it's been an interesting and an unusual type of event for FEMA to work in a pandemic situation. We're used to disasters with damages and so forth. So there's been a lot of learning and a lot of just different situations that have come about as a result of this pandemic. So just thank you all for your extreme amount of patience and understanding as we all kind of continue to learn together and get through this event. So just just as a reminder, if you have posted questions in the chat box, I'm going to be making copies of all the questions, and I'll get those sent out to everyone. I'll leave this Zoom up and going for a few minutes after I shut the video down, just in case some questions come to you. Also, as a reminder, I will be uploading the copy of this video if you want to listen to it again, and I will upload a copy of the PowerPoint slides to the same location on our Iowa Homeland Security website. It's not our grants management site, or it's not FEMA's grants portal. It is our Iowa Homeland Security and Emergency Management Department website. So, and again, if you have other specific questions, those should be mailed to our recovery correspondence mailbox. This information that I'm actually providing you was included on the initial email that I had sent out to everyone. So I think everyone has my contact information. If not, it's richard.biondi@iowa.gov. And with that, I think I'll go ahead and shut the recording down. Thanks everyone so much for participating today.